Hello, my name is Krakoski. I received my BS in Public Health at SHSU in 2021, and I'm currently a Master Public Health student, focusing on the social determinants of health and how those factors are incorporated into the planning of community-led health initiatives. The social determinants of health are institutions of society that directly and indirectly impact the health and wellness of people. The Center for Disease Control has grouped the major social determinants of health into 5 categories: healthcare access and quality, education access and quality, economic stability, neighborhood and built environment, or the idea of having a safe neighborhood and household, and social and community context, or the idea of having the opportunity to create and maintain healthy relationships. I had the opportunity to work with 2 different community partners in Huntsville, as well as learn about some of the barriers to social determinants of health faced by a specific population of Huntsville residents. Both of my community partners operated nonprofit community organizations that provided social services to individuals who were currently experiencing or were at risk of experiencing negative socially determined health disparities, including homelessness, food insecurity, economic instability, and more. I realized that this community was not defined by disparity from single social determinant of health, but that these individuals all faced barriers to at least one of these social determinants of health, and this can easily result in experiencing or being at risk of experiencing poverty and disparity that can lead to devastating health outcomes. After many semesters of observing and interacting with my community organizations and the Huntsville residents they served, I developed the Goal-Setting Technique for Nonprofit Organizations program, or the GST, which aims to increase the patient's self-efficacy over time. Self-efficacy is an important construct utilized in many health behavior models and is defined as an individual's belief in their ability to change behavior. Essentially, it determines how much an individual believes that they can achieve the goals they have. Knowing that every participant has different life experiences, the GST program allows each participant to decide on specific goals that they want to achieve. The participant is guided through their goal-setting sessions by their coach, in which they work through the GST manual worksheets together, which encourages the participant to actively develop detailed steps toward achieving their goals, particularly in ways that they decide are realistic for themselves. The core idea of GST is to incrementally increase the participant's self-efficacy and feelings of empowerment. If someone can learn to believe in themselves and their endeavors fully, they can positively impact any number of social determinants of health, and in turn positively impact their overall health. In April of 2023, the GST program was implemented alongside one of my community organization partners, the Trinity River Foodbank of Huntsville. The implementation of the program was met with unbelievable enthusiasm from the client participants of the Trinity River Foodbank. From the start of the program planning process, my community collaborator expressed deep interest and excitement for the benefits the GST program offers their clients. We have plans to implement the GST program in the spring of 2024 at Huntsville High School for students who could be considered at-risk youth. Successfully graduating from high school is a massive benefit in a young person's life, and I'm thrilled to see how the GST program will continue to support the health of this Huntsville community. As a Bearcat, I know that the measure of a life is its service, and this experience revealed to me just how true that sentiment is. This project was made possible through the Reba Bock Endowed Fellows Experience Scholarship, and I am honored to have received a scholarship in the name of Reba Bock. Her perseverance and leadership was a landmark for women's rights in Walker County. She was not afraid to stand up for what she believed. She was one of the first female public officials elected to office in Walker County, and through this, she empowered the women of Huntsville and all of Walker County, a population that at the time was in need of representation and societal respect. I hope to have made a fraction of the difference in Huntsville that Reba Bock made here a century ago. I'd like to thank the Center for Community Engagement, the family of Reba Bock, my community partners, and my absolutely wonderful faculty mentor for supporting me throughout this scholarship.